the panelists first. Dr. Raashi Mehta is a certified dermatologist with over 11 years of clinical experience. She specializes in evidence-based treatment of skin and hair concerns. Her work emphasizes the connection between skin health, science, and overall well-being. Mr. Yohan Tengra, who is the founder of Biohacking India, and a diagnostics-focused health practitioner. He is known for translating complex biological data into actionable health protocols. His work bridges diagnostics, performance health, and measurable outcomes. For the third panelist, we were actually going to have Florian Hurel, who was going to be here, but he's not well. In his place, we have his colleague, Tehning Yang, who is operations, training, and quality, who takes care of operations, training, and quality from Florian Hurel Hair Couture and Spa and F Hair Luxury Hair Care. Sorry, I don't have something to say about you since we just met. Maybe you could then introduce yourself. Yeah. You wanna? Yeah.
Good afternoon, everyone. Extremely excited to be here. At Florian Hurel Hair Couture and Spa, known for streamlining our systems for not just building our people, but also building our systems around it. Yes.
Perfect. Thank you. And the moderator for the session, we have Sanjana Balani, who is the founder and CEO of Potion Inc., which is India's first biotech-powered skincare brand. She bridges biotechnology, plant bioactives, and skin biology to redefine performance skincare. Sanjana brings a global perspective on longevity-focused formulation and innovation. Please welcome all the speakers with a round of applause.
Hi, good afternoon. Welcome to the Longevity Blueprint. My name is Sanjana and I have a fantastic panel sitting here. The intention is to talk about longevity across multiple angles. So we have Ms. Yang, correct, speaking on scalp science and follicle care. We have Yohan speaking on holistic health, and then we have Dr. Raashi speaking on the dermatology aspect. I will be adding in my comments from a biotech angle on ingredients that are supporting longevity from a complete surface level, but the intention today is really to talk about a comprehensive angle of longevity. We will have a 10 to 15 minute Q&A later on, so let's get straight into it. Thank you so much, panel, for being here. Over time, and increasingly so, longevity has become more mainstream. We are approaching aesthetic, skin, scalp from a preventative angle. More and more, we're not speaking about lifespan anymore. We're speaking about health span. People don't only want to live longer, but they want to age better. They want to do more at a later stage. They want to look younger and more youthful despite their biological age. So we'll just go one by one. Why do you think that is happening now? And why do you think we're at the epicenter of longevity across the board? Okay, so Ms. Yang, I think we'll start with you.
If you speak to anyone, they no longer just ask you, do I look young? They also ask these questions, am I growing? Am I aging well? Will I be independent? Will I be confident? Will I be healthier? And that has shifted the scope towards more holistic care. And longevity is now no longer just a facade on the surface. It's something that goes much deeper for each individual. That being said, it is supported by a lot of conversation that happens on social medias. It also happens on salon floors where people always come and ask for solutions more than they actually ask for just a look. So people have been looking for these solutions for a long time, and this shift actually does help us develop our skincare, our hair care, our services far better.
Okay. Thank you. So it has to do with a comprehensive feel-good factor as well. that's increasingly becoming more important because of the integration of the skin and health. Okay, great. Yohan?
Check. Personally, I feel that, I mean, if you look at the last 100, 200 years, modern medicine's been really good at, say, extending overall lifespan. So when we think about, say, the advent of antibiotics and sanitation improvements, vaccines, people have seen a net, say, increase in the overall life expectancy. We've gone from living, say, 30 to 40 years on average, now living 70 to 80. So that has opened up a whole new avenue because people never really used to live that long before to, say, have problems with chronic diseases as much as we do now, because the life expectancy has gone up so much. So people are coming, say, having more experiences in their family, and kind of people outside as well who they see with cancer and diabetes and kind of the diseases of aging. That's certainly one factor. Second is, overall, I feel that because of COVID, a lot of interest has, say, sparked in people just to be healthy, because everyone's seen death so up close. So that, combined with, like, what family members have experienced in the last couple of years, it's moved everyone towards a very preventive standpoint. If you just see the social media landscape and how kind of influencers speaking about this have ballooned over the last couple of years, certainly people have got more interested in taking control of their own biology from inside. There's also like a general distrust that's built up over the last couple of years in medicine and doctors, and just this whole idea of symptom suppression versus, say, actually trying to like take control of your own health and finding out inside what's going on. And yeah, all the clinical data is there to support it. We'll discuss some of that today, but certainly there's a lot of science on, say, like measuring different factors inside and how that connects to like skin and hair, which will be the conversation today. So yeah, looking forward to discuss all that.
Great. I agree. I think COVID was a huge wake-up call for people, and they remembered that turmeric and ginger were ingredients that were not only preventative, but they were almost life-saving when it came to certain aspects. But Dr. Raashi, what's your opinion?
So, is it working?
Yeah, it's working.
So, people are realizing now that, beauty as such is not just skin deep. Your physical appearance is, also dependent on a lot of other factors, in the sense, your stress levels, your lifestyle, how much you're sleeping, your nutrition. So all these things are also kind of adding up on how you're aging, right? And people obviously are more aware about these facts through social media, like, everyone is saying. And like, I feel the advent of AI has also opened up another stream of knowledge for people. If something happens to someone, a lot of us are just kind of Googling or asking ChatGPT that, what is the thing. If you're buying some kind of new product or a new nutraceutical, you would want to now know exactly what is it doing for you. So people are researching more, I feel, and that's also something that has, opened up this mainstream longevity thing. Instead of just focusing on the skin part of it, people want to know how to even feel good, as opposed to only looking good.
Yeah, no, I think that's a fantastic angle, and thank you for bringing up AI. I think we are in an era where knowledge is about instant gratification. When knowledge is more accessible, we are also more hungry to know independently and not being dependent on our doctors on, oh, he's given me this, this is what we need to do. This has pros and cons, which we also speak about, but I think this dopamine-driven knowledge is a very interesting angle on why people think they can biohack their own bodies. We're going to go more into the solo questions now. Save your questions for later on in case you have any specific questions on any of the angles when it comes to holistic health, dermatology, or scalp science. So, Yohan, we're going to start with you. Yohan is an expert when it comes to biohacking. He's the founder of Biohacking India. His expertise really lies in functional nutrition. Yohan, when we see instances of gut health and inflammation and vitamin deficiencies, can you statistically say that factually there will be a consequence to your skin and hair health or your bodily and holistic health as well?
Brilliant question. I'll kind of piece all the clinical data and insights together so it can make for better understanding. Let's take certain specific conditions that say typically see in clinical practice, so that
Yeah.
even people out here would be familiar with. My journey into this actually started because of my own skin issues. I mean, I had like severe cystic acne and seborrheic dermatitis, and then a general distrust of mainstream medicine, which kind of propelled me forward to say understand things more holistically. So yeah, I mean, in my own acne journey, and what kind of later got confirmed once I became equipped enough to even review the scientific literature, there's a lot of things that typically a dermatologist wouldn't be familiar with, which have been shown in the last couple of years in more recent studies to actually say improve acne from the inside out. We're starting to see research on the microbiome shape up in the last couple of years. There's clinical trials on pre and probiotics, like combinations of different fibers and specific probiotic strains, which have been studied in the context of acne. Internally, there's a lot of data on different nutrients and acne in clinical trials. Like you can take omega-3 fatty acids, EPA, DHA. There's very good randomized control trials showing they improve, acne lesions. Similarly, like there's many other compounds and nutrients. Zinc is a very popular one, but you actually have a clinically defined level in the serum where you can measure your zinc levels, and if it's say under 70 or so, then restoring zinc levels to ideal amounts like between 80 to 100 can actually improve acne. This has been seen in say studies which have been done over the last couple of years. So I'm just throwing some examples out here, but similar parallels extend into other skin issues like seborrheic dermatitis. We have some studies showing that certain B vitamins can be really important, like B6 and riboflavin and biotin. When it comes to things like eczema, we have research on fatty acids like gamma-linoleic acid that's been shown to improve outcome. Similarly, for psoriasis, there's research on topical vitamin D. It's like one of the most, say, evidence-based things, calcipotriol. So nutraceuticals are really powerful. Even on the diagnostic side, we have a lot of markers. I didn't speak about hair loss, but iron deficiency and ferritin is another important factor. So is vitamin D when it comes to hair loss as well.
Alopecia, sorry. What about alopecia? I think alopecia is also something that we're increasingly seeing now within the youth. Any sort of conclusions you can draw?
Yeah, there have been some interesting new data comparing nutraceuticals to established treatments. Like there have been some studies on finasteride versus pumpkin seed oil, as well as another compound that's missing my palmetto. Yes, there have been some comparative studies on saw as well as pumpkin seed oil. The mechanisms are similar. Again, the potency might not be as much as dutasteride or like finasteride, but I mean, we do see improvement in terms of hair outcomes as well when it comes to those things. I mean, and for autoimmune alopecia areata, we do have some research on H. pylori. I've seen this in clinical practice as well. H. pylori eradication can help to improve alopecia areata in some patients. That we know some of the mechanisms, like there's a similarity in the protein structure between the pathogen as well as some of our own proteins. So the immune system kind of lands up misfiring, and then you have autoimmunity happen in different areas. So yeah, I mean that's my overall view of things.
And these are common biomarkers that you can almost see as a conclusion to all of these. Another really important one I think we've increasingly been seeing is PCOS and hormonal imbalance. Within the biomarkers, is there anything that you can conclude from can you see someone's biomarkers and say, okay, this person is definitely someone who has PCOS?
Yeah, we have a full-blown diagnostic criteria. It's called the Rotterdam criteria. So it involves, say, evaluating for androgen excess. So you'll have elevated levels of bioavailable testosterone, DHEAS, and even total testosterone. You'll have like irregular menstrual cycles, and then on the kind of ultrasound side, you can do transvaginal ultrasound to see the follicle number per ovary. So that's typically like the whole cluster we use, and then it's an algorithm like 2 of 3 within these to diagnose PCOS. On the intervention side, there's a ton of research on nutraceuticals for PCOS. We have, I mean, myo-inositol even makes it to the guidelines, the guidelines which were published like 2 years back
Yeah.
by Monash University. So inositol is something that helps with various PCOS metrics, and there's a lot of research. I mean, like PCOS also I had to dive pretty deep into because my girlfriend like had PCOS. So we were able to introduce a lot of different nutraceuticals to target different markers. Again, I mean, all of this is evidence based. If you know what to look for in the blood,
Yeah.
you can target specific compounds to
Yeah.
like attack, like say DHEAS for example. It's a androgen precursor to testosterone. So we have trials on resveratrol showing that there's drops in DHEAS and improvements in different like ovarian morphology and acne and PCOS subsets.
Yeah. Yeah.
So the research is very interesting. Once you actually dive into it, I think a lot of people just have an overall bias that supplements aren't evidence based, and influencers just kind of sell them to make money off of affiliate codes and stuff. But there's a ton of research on these things.
Yeah, and marketing plays a huge role, and so do their budgets. But thank you for that. I think it is more objective than we think it is. Moving on to scalp care, Yang, obviously, Florian Hair Couture and Spa has been the first mover when it comes to putting attention on the scalp. You have an advanced scalp treatment. You have, I think it's also known as the 11-step Korean treatment. You were the first ones in India to actually place attention on it and to almost invite someone to come and look into their scalp health. How do you think putting this ahead and not placing as much attention on the aesthetic has put attention and put light on longevity when it comes to hair?
Like you all earlier said, we're now moving towards preventive measures rather than reactive measures. That being said, at Florian Neural Hair Couture and Spa, we do treat the scalp first and then the hair, because we do understand that scalp health is a cumulative result, right? It doesn't just depend on topical solutions. It also depends on how well you lead your life and how well you eat your food. This is something that has been common knowledge amongst all experts when it comes to hair experts.
Yeah.
But on ground level, when we have guests coming and visiting our salons, we do realize that this information wasn't commonly known. However, like we said earlier, the trend is shifting. It hasn't completely shifted either. So when we brought in Korean scalp treatment to India, it was such a success because now, along with the trend, we were again talking about preventive measures, because we can treat your scalp today, but you can go back and lead your life in the same way that you were leading before the treatment. So the treatment alone is not going to get you from where you are today and your ideal scalp health. It would be a cumulative effort that needs to be put towards not just improving what treatments you get done, how well you exfoliate or detoxify your scalp, but also how well you nourish your body. And I think this is where your panel somehow comes together really well.
Yes,
So,
yes.
yeah.
And I think a lot of us feel like the only time we get to take care of our hair and fix our hair is when we go to the salon. But I think things have changed, right? And I think Yohan brought up COVID. COVID actually was the beginning of so many DIY hacks that puts control back into you. So today when you are at Florian getting a scalp treatment or getting follicle care done, a lot of the sustainability and longevity of that, and please correct me if I'm wrong, is when you go back home, correct? But very interesting angle when it comes to how much your diet has to do with the longevity of your hair. Coming to Raashi, when it comes to skin and longevity of your skin, a lot of people are talking about your microbiome. A lot of people feel like there are certain ingredients that are now becoming popular, perhaps also after COVID. Do you see any ingredients that are popular now because of this focus on longevity that never appeared in the past?
So because of social media, because of influencers, there are so many ingredients now that people were not aware about, say, maybe like 5 to 7 years ago. Like people didn't know what is vitamin C, what is niacinamide, what is hyaluronic acid, what are ceramides. But now, because of the new products that are coming out and influencers talking about it, including dermatologists as well. People are just so much more aware about these ingredients which act on different aspects of the skin, including the longevity of it as well. Like for example, you take niacinamide. It was a very trending molecule like 2 years back. It was like a miracle cure for your open pores. It would hydrate your skin. It would help with your acne, marks, everything. Uh, but I mean, like when you go to your dermatologist and ask them that, is only niacinamide going to help me in all these aspects? I would say yes, to a certain extent, but it's not going to completely, treat your skin. Just one ingredient cannot do that. We need like different ingredients working synergistically to give you, the results that you require. So yeah, I feel that there are a lot of ingredients that are coming up topically that have the potential of helping with skin aging. So earlier, like we used to focus more on things like retinoids. Now there are things like peptides, there are exosomes, there are topical PDRN, and there are different formulations of retinoids. That is one thing that I wanted to talk about, was that the formulations of products have really improved over the years, I feel. Like earlier there would just be like a cream or a lotion form of it. Now there are gels, there are serums, there are masks, and they are all targeted for a particular skin type. So there will be different things for dry skin. There will be something else for oily skin. There will be like something else for sensitive skin. So for example, if you just take like a normal sunscreen. Earlier, I mean, a lot of people would not wear sunscreen because they would find it too greasy on their face, or they would make their skin too oily. Or it would have this white cast that people didn't like. But now, I mean, there are so many formulations. There's gel form, there's like a watery sort of sunscreens available. There are matte finish ones, there are tinted ones, there are sun sticks, there are sprays. I mean, the list is endless, and now like people don't have an excuse not to wear sunscreen. It's like that. So these are like some of the things that I have been seeing over the years, which are good things, I feel.
Yeah, and it's also cool to wear sunscreen now, which makes things, it makes it a nice conversation starter. Oh, I'm using this Korean one, what are you using? And if you don't use sunscreen, you're completely out of the conversation. But Rashi, another question. I feel like, especially because we come from such a rich, deeply rooted culture here in India, we don't only put turmeric in our food, we put it on our face, we put it in our hair, we put it everywhere. So can you bust this myth for us? If you put chickpea flour, which is besan, and if you put turmeric, which is curcumin, or if you take malai, which is, lactic acid, and if you take milk and dump everything on your face, does it have effective benefits, or are we just wasting the ingredients?
So I have been, making a series about this, which I've called like Grandma's Nuskas versus Science. So basically, just kind of examining these home DIY sort of things and seeing if they actually have any value in our skincare and hair care routine today. So like for example, you're talking about turmeric. Yes. So turmeric basically has an active called curcumin, which is giving it all its effects. Your anti-inflammatory effect, the effect on the tanning part. It has wound healing properties. But the problem with your store-bought curcumin, turmeric, is that it doesn't have a very high percentage of curcumin. And also the penetration of the curcumin inside the skin is very poor. So instead of using haldi alone, you can actually use formulations with curcumin in it, especially when it is combined with other antioxidants like vitamin C or hyaluronic acid, niacinamide. It has better penetration also and a better effectiveness as well.
And curcumin extract, and correct me if I'm wrong, doesn't necessarily have to be yellow, does it?
So curcumin is something which gives the haldi its color. So I mean, naturally it is yellow, but there have been ways to kind of remove that pigmentation from curcumin.
And still maintains efficacy.
Yes, yeah,
Okay,
without affecting the efficacy part of it.
And if we take curcumin and we ingest it, right, orally, the benefits that we get are not the same as if we are applying it topically, correct? Does it take over an anti-inflammatory role if we take it in orally?
Yes, so curcumin has shown to have an anti-inflammatory role, helping with wound healing,
Yeah.
helping with chronic disorders. I'm going to be
inflammation.
talking about skin mainly.
Yeah,
So, yeah.
correct. So I think there are some really interesting myths to be busted when it comes to holistic health ingredients that will benefit, and then topically these ingredients don't. There could be a possibility where they actually do not have any efficacy. You can ask Raashi questions later as well. But we're moving on to the trend aspect of this panel. Everyone is now on Instagram. We're more connected than we ever were. Korea is influencing India in ways and at a speed that we didn't even realize. We're starting with Yohan. Yohan, there is a trend currently on holistic health called fiber maxing, where you need to maximize the amount of fiber that you're taking in, and this has direct correlation to your overall holistic health, and ingredients like psyllium husk and chia seeds are taking precedence. Have you been able to find evidence when it comes to the facts of this trend?
Okay, just to give some background context, I think the fiber trend is, say, coming after the protein trend. The protein kind of hype has been, I mean, rightly so. These things needed to become trends because, most of India is protein deficient. They don't have the same problem in the West, but out here at least we did have a significant protein deficiency issue, and that's still largely not addressed to the extent that it should be. So that was certainly great, but now we have the rise of fiber. The problem with this is that there's two sides. Like, one is the evidence base behind fiber itself is some of the strongest we have in nutrition science. When it comes to, say, binding heavy metals in the gut or lowering LDL cholesterol levels, or just in terms of even outcomes, we have studies looking at millions of people lasting, decades, where we see, large reductions in overall mortality and stuff from, per 10 gram increase in fiber, you see a linear increase in life expectancy and things like that. So on the, say, chronic disease side, the evidence is very strong, which is why even some, say, cardiologists, if they know what they're doing, they'll recommend increasing fiber intake because it helps to lower, cholesterol levels, which is, say, one of the leading contributors to stroke and heart disease and stuff. So that's on the chronic disease side. On the, say, more skin side and hair side, which is what the panel is focused on today, certainly we do have some research, like I referenced. Even in acne, we have research on pre and probiotic supplementation. Again, with probiotics, a lot changes depending on the exact strain and the strain ID and everything, so you can't put them all under one box. But there's certainly specific strains which have been studied for different skin conditions. Even within fiber, it's a mixed big bag. Not all fibers are the same. You have some fibers are more prone to causing, say, bloating and GI distress because of FODMAPs. FODMAPs are a specific category of fermentable fibers which can contribute to GI distress. A lot of people typically try to increase their fiber intake and then land up with GI symptoms, and then kind of get discouraged doing that. There has been at least one interesting trial. I think it was done by Harvard a couple of years back, where they were looking at fermented foods versus just fiber versus probiotics. The fermented foods group was able to tolerate the fiber. The people were able to tolerate the fermented foods the best. When it came to fiber, we saw three different responses in the trial. There were people who, say, got a pro-inflammatory response from increasing fiber intake. There were people who had a neutral response. There were people who had an anti-inflammatory response. So researchers have been, say, speculating that, the diversity of the baseline microbiome itself, what microbes you hold before you increase your fiber or take some probiotics. Like that would have a big modulating effect. So now we are starting to see like more trials trying to narrow the question down. But certainly the kinds of fibers we can tolerate, there's a couple. I think like in all of my clinical experiences, seeing patients as well as reading studies, psyllium husk as well as there's another one called partially hydrolyzed guar gum. Those are the most easily tolerable fibers, which also have great evidence. Like PHGG has actual evidence on, say, reducing transepidermal water loss. So, like metrics of
Hydration,
skin
yeah.
hydration, basically.
So fiber and hydration are directly correlated.
Yeah, we do have. I mean, this is interventional
Wow.
evidence. It's not even like just observing, but we can do this
Yeah.
in a controlled trial and see the changes in the skin barrier.
Fantastic. Yeah. It's interesting also because a lot of people, including myself, actually we consume chia seeds, right, for the fiber. But if you don't hydrate well enough, the chia seeds actually doesn't do its job. So that actually is exactly what you're saying. I had no idea as well. So does this also relate to, for example, consuming fiber through fruit and then needing to hydrate?
We have to extrapolate a little bit. I mean, there's a ton of evidence on fruits and vegetables being
Yeah.
great for like, even for skin
Fantastic.
outcomes. For example, there's a typical type of dietary pattern called the Mediterranean diet. So we
Yes.
do have evidence on the Mediterranean diet and skin-related outcomes.
Yeah.
But the Mediterranean diet is a very broad pattern where you're having legumes and fruits and veggies and
Yeah.
nuts and fermented foods and
Yes,
fish
yes,
as well. And
yes.
yeah, so I mean, we do have evidence that a broad dietary pattern of including these foods does help to improve different skin metrics. Yeah.
Fantastic. Definitely a certain correlation that I wouldn't have thought of, but thank you for that. Yang, a trend that's happening in hair care today is I feel like people are starting to put certain active ingredients like salicylic acid, perhaps hyaluronic acid, on their scalp, right? And I know Florin as well has been working on his own line. And we've been seeing multiple brands, including brands like The Ordinary and The Minimalist, who are infusing active-led shampoos and conditioners specifically for hair care and for scalp science. Have these shown improvement? Do you think we're going to be increasingly seeing salicylic acid shampoos?
You can't say if we're going to see salicylic acid shampoos, but yes, we will see improvement in this because so while the scalp is an extension of your skin, it is designed for hair growth. And that is the biggest difference, right? So while we have that difference in place, we use technology like AI analysis before our scalp treatments, wherein you no longer rely on the expert behind the chair. You now rely on information which is right in front of you, which tells you about your scalp inflammation, your scalp redness, if you have product buildup, if you have sensitive scalp or dandruff, right? It allows us to actually see the problem and then address it. So this change in trend, obviously, and then we have supporting active-led ingredients,
Yeah.
which help us perform these services,
Yes.
right? So it's technology hand in hand with active-led ingredients,
Yeah.
which will help us get to that desire of longevity when
Right.
it comes to scalp health.
But when it comes to something like, for example, unclogging pores when it comes to my skin surface, and I'm using some sort of exfoliant, let's say salicylic acid, can I conclude that the salicylic acid will perform in the same role that it does on my surface as on my scalp?
I don't think anyone should conclude that for themselves. We
Yeah.
should always rely on research and studies that, are done by experts because honestly, yes, we can all sit and try these things ourselves, but
Correct.
I mean, we are here talking about the efficacy of products and
Absolutely,
the efficacy
absolutely.
of ingredients ourselves. So yes, while the knowledge is present, half information is always dangerous, and we'll come into that. So
Yeah.
yes, it's always good to take expert advice when it comes to that, because we should not be putting things or trying or testing them ourselves, because I mean, once you lose your hair, come on, gonna end up going back
Yeah,
to
then
the
we go to
doctor.
Johan.
Then we go to Johan.
No,
So,
but I think
yeah.
it's, thank you for that. I think, sorry? Yeah, absolutely. Please go ahead.
Okay, so you were talking about salicylic acid, supposing,
Yes.
for the scalp, okay? Yes, salicylic acid can be used on the scalp, but for certain conditions only, okay? If you've got a dry, flaky scalp, and only maybe your, anti-dandruff shampoo isn't cutting it, you can use it in those instances. There are certain medicated shampoos available with salicylic acid in it. You can use salicylic acid toners or serums as well, but make sure that the percentage is not more than 2%.
Okay.
And after application also, you have to make sure that you are keeping it on your scalp for at least 10 to 15 minutes to actually see an effect. So a lot of patients do this, they'll put the medicated shampoos or the serums and then they'll immediately wash it off, not giving it enough time to be effective, and then they do not see the results. So that is something
Yeah.
that you need to be careful about.
Yeah, I agree. I think it's the little steps as well, Raashi. Thank you for saying that. I think
If I may add just one more thing.
Of
It
course.
also starts with self-diagnosis. I think we should avoid self-diagnosis.
Yes,
That is
yes,
the
please.
biggest challenge I think all of us face is people
go to
diagnosing
ChatGPT.
themselves.
Yeah.
Yes, it's okay to research and ask questions to know more, but always get the opinion from an expert who has, who knows far deeper than anyone else. Yeah.
I agree. I think as an example, I know tons of people who they have flaky skin or they have a flaky scalp and they think it's because they're not using the right product. They're probably just not consuming enough fat in their diet. And then they go and they chat GPT that, they're using the wrong products. It causes more problems. So I think we have all of the information available, but leave it to a human and an expert to administer this. Moving on to something that's really important for all three of you is because the mentality around longevity and preventative methods has changed. Another really important aspect is marketing and mindset, right? And so we leave it to the larger companies to really create businesses out of this. What do y'all think, and I'll go through each one of your answers, what do you think in terms of marketing language, marketing jargon, what do we need to stop saying and what do we need to start communicating instead? So Raashi, maybe I can start with you from a skincare perspective.
So for skin especially, most of the marketing that's done, promises like flawless skin in 2 weeks, supposing. Or, like this one product's going to be a miracle cure for like pigmentation, for your pores, for anti-aging, for everything. And I mean, so nowadays, I think patients and consumers are also more educated. They do their own research. So the marketing industry needs to realize that and kind of come up with more credible and transparent ways to do their marketing.
It's not as dopamine
it's-
driven.
Yes. And give like scientific basis to why they're using this ingredient and what the ingredient is actually going to do versus what they're claiming it's going to do.
Yeah.
you
So
know.
bring it the inside, bring it as an
Yeah,
inside
just
out
be
approach.
more transparent about
Yeah.
the product.
Yeah. Okay, Johan, what's your take on marketing?
Firstly, I think people should just have this as a background idea in their head whenever they're scrolling on Instagram or like say, watching YouTube videos. When it comes to influencers, pretty much all, like I would say most of the content is set up in a way which is either redirecting to a product or an affiliate code. So, I mean, like people are typically skeptical of doctors because, there's all kinds of hesitations around them, making money by recommending certain procedures and stuff. That does exist, but the same thing kind of exists in the nutraceutical and say, wellness influencer landscape as well. So yeah, I feel like personally also looking at a lot of the claims and the marketing that happens around a lot of these ingredients, most of it is just like really overhyped. I mean, the minute you hear something like this one ingredient is gonna fix everything for you, like just like stop following the person. Like science, the nutrition science specifically doesn't work that way. So yeah, that's certainly one thing to keep in mind. On the improvement side, I feel that we are gonna see a wave. I mean, it's already kind of bubbling up, but there are going to be more influencers online who are going to start to explain people how to think scientifically, how to review research, like which research is more clinically relevant versus which ones, like you shouldn't take an animal study or a cellular study seriously compared to, like a meta-analysis of human clinical trials. So just that bit of education, I feel like is going to pick up much more, and it's going to make it harder for marketers to say, pitch things based on, oh, you take this, it's going to go and like do this in your cell, or it's going to go and change this pathogen in your microbiome. Like that kind of storytelling is going to be less appealing to people going forward, because everyone pretty much, you can sell any story for any active, by talking about some biochemical pathways. That's a lot of how the false marketing gets done also.
Yeah.
Because just because you can see some results in a cellular study, it doesn't mean it's actually going to translate to getting human outcomes. I think that certainly needs to stop, because customers themselves are going to get more, say, street smart to that going forward. Also, I feel like specificity is needed. If we are saying that, say, for example, astaxanthin, it's like a carotenoid that's found in certain seafood. We have a lot of good data showing that it helps to improve, say, wrinkles and dry skin and things. So the marketing needs to be more specific. Like, what exactly did they improve in the study? Was it TWL, which is a marker of, hydration in the skin? Was it actual, say, measurements of fine lines through certain technology? Like the specificity needs to come in the marketing, which I feel right now is a bit too vague. It's more like, just take this, it'll help to fix all of this, that kind of thing.
Yeah.
So yeah, I think those changes would be valuable, even for, say, development of products, as well as the marketing. If formulators themselves can just start making things based on actual clinical data rather than hype. I think a lot of formulators also chase novelty, which is not really, like backed by anything, just coming up with, say, liposomal forms of different supplements and stuff, because it's all the hype. You don't really have the data. I mean, in some cases, like liposomal formulations can give you too much of something and actually cause more damage,
Correct.
So just like, I feel it'll be a shift from both ends. The consumers also getting smarter when it comes to science, and then that should also like be followed up with the marketing shift. Yeah.
Go ahead, Raashi.
What I don't understand is how do they come up with all these percentages? Like you see all these pie charts and diagrams.
Where is it
Okay,
coming from?
Yeah, where is it coming from?
Yeah, and I think, sorry to cut you, but I think a lot of marketing campaigns, that's why, are highlighted to me, because right under they've written for how many applicants, what the trial is, what is the age group. Look for those, because as soon as they're claiming that, of course, even then, I'm sure you can't conclude that it's actually been done. But I think just having that extra layer of confirmation helps tell the consumer that there is some intention behind it. But I think, as Yohan and Raashi have both concluded, is question them, right? Dig deep into why is there 10 times more hydration in X than Y? Where did you conclude it from? Are you getting it third-party lab tested, right? Does that make sense? Or there are also independent studies where, as a consumer, you can get it third-party lab tested. But thank you for that, Rash. Siang, yes. What is your opinion on glossy hair ads, and do you think the marketing language needs to change?
Well, not just glossy hair ads, but let's talk about hair growth, right? Regrowth. We've seen just in the last 5 to 10 years, every new season, there's a new hype, a new ingredient, novelty, like we were talking about earlier. And you see a lot of new companies just come out of nowhere, where they've taken this one product. I don't know how much of the research they've done themselves, but for some reason that is the main product they're talking about, and they start selling hair growth serums. But soon after, there's a new hype, there's a new product, the old product's out. So I think when it comes, not just marketing, I think overall regulation of marketing is something that needs to be looked into, because of misinformation. Yeah, because things like hair growth, while they can and can't be reversible, it depends, right, on each individual's, how did they get here, how did they get to this problem.
What is the root of the problem?
And yes, doing a root cause analysis for each individual. I think that's why even Kucha comes into place, right? We tailor make it for each individual. So yes, I think marketing has to shift away from more trend-based marketing and towards something that's more factual.
Yes.
More
So rosemary
factual.
oil doesn't fix hair growth.
Not alone, right? Not alone.
Correct.
It can't do things
So
alone.
it could, and I think all of you agree that we need to approach marketing in a more factual, in a more objective, in a more data-backed way. If someone is telling you something, it doesn't mean it's necessarily the truth, but make sure to understand why and where it's deriving from. So just to kind of conclude, if there was one thing when it comes to the scalp, when it comes to holistic health, when it comes to dermatology, if there's one actionable takeaway that someone could do today to prevent and accelerate in terms of their longevity? Raashi, I'm going to start with you. What do you think that's one takeaway that they could take today from a skin perspective?
Stop Googling and chat GPTing everything. And talk to your dermatologist, address your concerns with them, know what ingredients to use on your skin and why to use it. Question your dermatologist. Don't just blindly see your prescription and, you know, like, whatever, start using it. Ask them why are they giving you things for, you know, use. You're paying them, right? You might as well get as much info you can from them.
Any ingredients that you are currently obsessed with, Raashi?
So nutraceuticals, I feel, have really come up even in dermatology, and I, as a doctor, don't like to give all my patients like really heavy medication. You know, I do like to use supportive care more. So, like, for example, for acne, like Yohan said, omega-3s, probiotics, zinc, and if, you know, the patient has underlying PCOS, minoxidil-based supplements, these are things that I do like to prescribe along with, you know, the topical aspect of it. One more thing I'm obsessed with right now is collagen. Yeah. So collagen as an oral supplement, not topically, is a great molecule for anti-aging. It hydrates your skin. It has an antioxidative role as well, and it helps to strengthen your hair and nails. So overall, as a skin and hair supplement, it's a really good molecule that, you know, I am recommending to a lot of my patients, and they are seeing changes. Yeah.
And one way to detect a good collagen, is it hydrolyzed marine collagen, which is probably,
Yes.
yes, any
Yes.
types? Type.
Hydrolyzed marine collagen. So the major types of collagen in skin and hair is type 1 and type 3, and the hydrolyzed marine collagen peptides basically covers, you know, these two types. So
Okay.
yeah, I mean, that's a good source of your collagen.
Yeah.
I don't know how vegan collagen works because there aren't enough studies on it
Correct.
right now, and I mean, that I think we'll have to wait for the research part
Yeah,
of
marine
it. Yeah.
collagen. Okay, super. Johan, one takeaway: functional nutrition, holistic health.
I think people should just start having a handle on at least the key biomarkers that we now know are, you know, say contributing to different risk of chronic diseases, as well as can explain a lot of the symptoms they face as well. So yeah, I mean, getting a comprehensive panel of markers and then getting that evaluated from someone who can actually tell you what like your root causes are within that, and then how it's basically connecting to your symptoms and what increased risk it's going to give you of different problems. I think that that's like the compass and roadmap even I use for like all my patients. So
Yeah.
we just start with, you know, markers which we have a ton of data on, which if we improve combined with the clinical picture, like we see great results for
Yeah.
many different conditions. That's just, I think people start doing that more than, say, you know, I mean, yeah, people do blood tests, but then this whole self-evaluation culture, like you just put things in Google or GPT. Even with using AI, it's like a very powerful tool, but I mean, the person who's kind of directing the AI and asking the questions makes the world of a difference. Like a consumer's basic question would be like very primitive compared to someone who really knows the field. Like the questions and follow-up questions you would ask to an LLM would be very different.
Yeah.
So even just realizing that, like, you using AI is not the same as your, say, practitioner, like, you know, digging AI for research and looking at very specific things within that. So that's one thing. I'll just answer your question on favorite ingredient as well, since you asked her. Mine would be N-acetylcysteine. I've been using it for a very long time, and I feel it's like one of the most powerful compounds for dealing with like a wide range of conditions. I mean, if you ask me like what all NAC has been proven to help, I can, you know, start citing like 20, 30 different endpoints that way.
Yeah.
Even in PCOS, or when it comes to even increasing glutathione levels, actually, there's been comparative research looking at N-acetylcysteine versus oral glutathione. It actually outperforms oral glutathione when it comes to systemic absorption, because a lot of the like I'm not talking about liposomal glutathione, but regular oral glutathione gets broken down in your stomach. So the bioavailability is lesser than even taking a precursor. So taking like NAC as a precursor actually increases glutathione levels more, and that has a ton of benefits for chronic inflammation, for even like fatty liver, PCOS. There's many different metrics. Yeah.
That's fantastic. So that actually means that if someone is looking to prevent wrinkles, you will actually benefit if you not only go to a dermatologist, but you actually also get your biomarkers done. Correct, Yohan? Okay, so everyone's coming to Yohan. All right, Yang, when it comes to hair care, scalp science, one thing, one takeaway that they can do to take better care of their scalp.
First, stop looking for a miracle product. One thing does not fix everything. All right. That's what everyone does, right? We look for one solution that's going to fix it all. And that's why one shampoo is not going to give you shiny hair for the same reasons. Because everyone has different hair. Everyone has different scalp. And our scalp is not just for cleansing, right? It does a lot more. It's like a field. And depending on how well you look after it, so it's going to be your yield. So just like that, the best takeaway would be not to look for that one solution. Look for a care system that is wholesome, not just with your stylist, but also with your dermat and also now with your biohacker, right? I think that sums it up for you.
Thank you, guys. No, I think that's been really comprehensive. That concludes our panel. If there's anyone that has questions on a generic question, on a specific angular question, this is your time to ask. Yes.
Yeah, my name is Pradeep Tendulkar. This question to Yohan and Dr. Raashi. Melatonin is again a lot of trending out there, and after COVID, sleep was the biggest problem. And what is your take on melatonin from the nutritional supplement and from the topical perspective?
So topically, melatonin has been added to as something for your hair growth part of it. Yeah, so it's being combined with minoxidil, with finasteride, with azelaic acid to give better penetration to the minoxidil and also act as a supportive therapy for hair growth. The exact mechanism of it is still not very well understood.
On the internal side, I think melatonin is a very misunderstood molecule. I think even just last 2-3 months back, there was a lot of fear mongering going on about it because there was one observational study which showed increased risk of heart failure with melatonin supplementation. That study was like very low quality and they didn't adjust well for typical things which would influence the result. Like they didn't collect data on sleep apnea in the study, which could, or even they were just looking at people who were taking over-the-counter melatonin by the health record, and that excluded people who could just buy it. So there are a lot of limitations with that. But when it comes to the data on melatonin, I feel like even in practice, it's one thing I always try to use. One is just increasing your internal melatonin by wearing blue light blockers at night. I feel like that's super important because as we age, our melatonin levels go down. So we do have that angle of, say, looking at it. And even when it comes to clinical research, just like NAC, I think melatonin is a really crazy molecule. I mean, if I start telling you the number of conditions we have, like clinical trials where it helps, it's an endless list. So even for things like IBS, gut issues are really common. Melatonin has a lot of data showing improvement in constipation and bloating and things like that. When it comes to pain, when it comes to actual reduction in inflammatory markers, like Raashi said, even topical melatonin has a lot of data. Even on PCOS, melatonin has a lot of like good clinical research. So I think topical internally as well, for insomnia, of course, that goes without saying. We even have good understanding now on the exact dose which helps insomnia the most, because we have those many trials where we've kind of analyzed it and come to a better dose understanding. I think like 3 to 4 milligrams for most people is the typical dose that's used in a lot of these studies. Even in fibromyalgia, melatonin has benefit. It's an endless list, honestly. So it's like a really great compound. Of course, I mean, some people get grogginess the next day if they kind of take it. And then some people use melatonin to mask deeper issues. Like for example, if you have, you know, like sleep related issues from something like sleep apnea, and you're just taking melatonin to cover for it, you're missing a much bigger like upstream driving factor. Because if you have sleep apnea, you're not getting oxygen at night in your, you know, body, and that's going to increase your risk of cardiovascular disease and hypertension and a lot of things. So of course, I mean, we shouldn't get in that whole mindset of symptom suppression, which is why when we have symptoms, just getting a proper root cause analysis is very important. Because if you go to a good clinician, you know, they'd be able to look at your symptoms and tell you like if they're suspecting something, checking for that, ruling it out, and then the supplements and stuff should be like you know, a responsible intervention depending on the individual, not something that you just take randomly that way. Yeah, hope that helps.
Thanks.
Hi, I'm Dr. Siddhi Advani. So I actually have a couple of questions, but the first one that I'll get to is that supplement stacks are becoming very expensive, right? There's a lot of signal and there's also a lot of noise. Now, everyone's trying to biohack their health, they're trying to biohack their skin. These supplement stacks are becoming expensive. And so it is that the frequent complaint that I keep seeing is that longevity is only meant for the 1%, right? So you have these expensive supplement stacks, frequently with exotic ingredients, driving up the prices, and as such making longevity only affordable to the 1%. So, and you also have the sustainability angle, like some of these ingredients are sourced from the Amazon, or like, you know, why destroy a habitat for humans to live? We've kind of been doing that for a while. Maybe we should slow down on it a little bit, or consume mindfully. So considering that this is an ingredients, like the focus is ingredients, what do you think has the most promise? Or say if you could wave a magic wand, what new ingredients or new formulation or new product would you like to see out in the market that you think has greater potential than what's already out there?
Interesting question. I think, see, my research is extremely clinically driven. Like, I have a background actually in just evaluating primary literature. So whatever even I use in clinical practice, so I have an education vertical as well. I teach practitioners and stuff. So whatever I even recommend for other people to use, it's everything has to have, like, you know, when you're doing interventions, we need to have randomized control trials for them. So if you ask me my opinion on a new ingredient, that would just be kind of like my, you know, opinion, which even I don't take so seriously. Like, we kind of in medicine and you know, kind of science, we just look at the data and follow the data basically. So yeah, I think even with respect to what's out there, kind of addressing your question about expense, a lot of people are doing work to bring that down. Like, I know diagnostic providers who are, I mean, I work with one of them. I formulate say like blood test packages, like make them cheaper, try to get more markers inside. So the more that this whole space is exploding, over time you'll see the cost coming down for a lot of things, because things will get more competitive. And even on the diagnostic side, like a lot of labs have kind of say had steep prices, because doctors wouldn't typically order these tests for most people. So the cost for them wasn't, say, justified enough, and they would have to, you know, keep higher rates. So that's definitely already come down and going to keep coming down. On the supplement side, I think where I would address your question is clinicians need to be a bit more, say, responsible and proactive with trying to select the ingredients which help with multiple conditions a patient has in the least amount of pills. This is where being familiar with the trials on every single compound becomes very important. Like, I gave examples of NAC and melatonin. If I have a patient who's coming in with gut issues and pain and you know, like insomnia, melatonin is going to be my first go-to, instead of giving him, like, say, you know, artichoke for gut issues separately, and then for insomnia, you know, I'm using chamomile separately, and then for pain, I'm using something like omega-3 separately. You need to try to look for things which help with multiple conditions a person has together, and that's going to differ for each individual. Because you might have a different symptom cluster combination, another person might have a different one. I think that's where the cost can come down a lot from a practitioner's side, but provided they are, you know, like, say, deeply familiar with the research on these things and accordingly can help you customize. this is something I actively work towards because even my supplement stack is super expensive. So I'm incentivized myself for a long time to, make things cheaper for myself. And then I would say there are a lot of great supplement companies also now. And the whole landscape in India has changed a lot. I remember time, say like 5 to 7 years back, I would be ordering from abroad, and the customs on top of the, like steep prices, it's just, it's insane. So everything's already gotten like way cheaper. Like there are brands who can give you, say, omega-3 fats, like say krill oil, fish oil, which you would get. I remember paying like 6,000-7,000 for a month supply for them 7-8 years back. I now get it for $800. So I think things are getting better overall, and then it's just going to keep getting cheaper because this whole thing is just exploded into like popularity and momentum. So things will keep getting better on that side for sure.
Also, more than looking for newer ingredients, I feel the existing ones, they have potential, and research is being done on them to find newer indications for them. In the sense, say for example, vitamin D3. Okay, so earlier we would just be probably focusing on, its use in skeletal health, right? But now it's been shown to have like what do you say, promise in so many other conditions as well, in all your dry skin conditions, and even in as an anti-aging molecule, its researchers have shown that it prevents the cellular death itself. So I mean, and cost-wise, I mean, vitamin D3 can be, like got for like very, very minimal cost. The dosing is also not something that needs to be taken daily. If you have a high dose vitamin D3, you need to take it maybe once in 2 weeks or once a month. And that, gives you like amazing benefits on a number of things. So, you need to pick and choose that ways. Even as clinicians, we try to give, the maximum number of supplements. So there are a lot of drugs available which have a combination of supplements. So we try to give those rather than just giving like one single molecule to the patient, because we want to reduce the pill burden of the patient and the cost as well.
All right, thank you. Any other questions? If we can take them offline. But my panelists, thank you so much. You've been fantastic. And that concludes the panel, guys. Thank you.